Welcome to Let's Chat, an informative web chat series brought to you by the American Nurses Credentialing Center Nursing Continuing Professional Development Accreditation Program. We're delighted to have our friends and colleagues from Area 9 with us today to talk about adaptive learning and how that can be applied into nursing continuing professional development. Welcome to Let's Chat, brought to you by the ANCC Nursing Continuing Professional Development Accreditation Program. We're so excited to have our friend and colleague from Area 9 here today, Dr. Karam Jamil, who is the co-founder and president of Area 9, and we're going to have a nice informal chat about adaptive learning and its value and relevance in professional development. Thank you for coming.
Thank you, Jennifer, for having me. Sitting here inside, locked in.
Yes.
Like you,
yes.
in the kitchen.
Yes, I'm in the kitchen. And I don't cook, so don't ask me what's in my stove. Shoes.
No. Super.
Yep. So, this is an informal dialogue for you to share what adaptive learning is and its relevance today. So I'm just going to let you take it away.
Super. So, think about it this way. So pause and think. You can do it with open eyes, closed eyes. Who was your best teacher ever? So if you think that, those of you who are listening, various things will come up. And I think one of the underlying theme of that would be, some of the things would be probably like, my math teacher was a super great listener, or asked me good questions, or was compassionate. So of course we have various experiences with what a great teacher, coach, or tutor was. And adaptive learning for us is basically that exact human personal tutoring, recreating that at scale, but using computer science for it. That's when kind of modern adaptive learning, that's what adaptive learning really means. But adaptive learning in essence is not new. We've all experienced it when we have had a great teacher, teaching us something. The challenge with great teachers is, of course, they can't reach everyone. And if I could recreate my best teacher, which was, personally, if you ask me, it was probably my math teacher in K-12. He was really good at listening, because what he was listening for was where I needed more help. Mm-hmm. And that's why I still remember him. And of course, later I've had at med school, I had great teachers as well. But I also remember those that were not super good. They could improve. And that was those who were basically just giving me the same lecture and did the same lecture the semester before. So one size fits none. And even though they knew a ton about the subject, I remember a embryology lecture where he was known for, the professor, for just knowing every single detail of how the embryo develops. But he never asked really questions. He never stopped. And that was, for me, that's not adaptive learning, right? So what we have done is that we've, over the last many years, and now soon 2 decades, built systems that address what the individual needs. And, that has led us to developing programs, because the platform that we have is content agnostic. So it has led us to deliver adaptive learning programs to everything from nursing to students, medical areas, and also outside medicine. So it's a long answer to a short question.
Yeah, no, it's great. I quickly jotted down a couple things that you said. So for our viewers that see me, when I look down, I'm not on my phone, I'm taking notes. But I think a couple things that you mentioned are key for NPD practitioners and nurse planners is that concept of one size fits none. That we have historically in professional development for nursing looked at a global one size fits all, but we really have to look at whether it's individuals or individual teams, departments, differently, because the need on one unit could be a different need on another, but they both
Exactly.
have common goals or outcomes that they need to achieve. So that ties in nicely with our educational design process, where we ask the NPDs to look at gaps and not focus on that 30,000 foot global, everybody needs this. It's not a one size fits all. So I liked that. And listening for need, right? Using our senses is critical. And so those were just a couple things I jotted down that were very meaningful to me, at least. Go ahead.
And no doubt the human nurse teacher, so to say, is the best to do that. But we now have technologies today as well that can, to some extent, actually sense by sort of say listening. And the way that the computer system can listen is by assessing. And that's why we use the adaptive learning has a very question first approach. So basically you teach by asking questions, because then that's the way that the computer system can actually listen and see where does this person needs specific attention, and then you provide that content to that gap. So you can, to your point, having the overarching curriculum is super important, but then putting that into smaller pieces, which is the granular process of curriculum development, which is an integral part of building an adaptive learning curriculum. When that is then added into a system, then that can deliver it in an electronic mean, then you actually get that adaptivity and that experience as a learner, that this feels like this is a personal tutor actually helping me through the curriculum. And that's what when we have people going through adaptive learning programs, that's what they feel. So I think one of the things that we also talked about was that, and I'll share that, why it could be relevant today, right? So obviously right now, there's a huge need for remote learning, because everybody's sitting at home. Well, not everybody, but we at least need a reliable way to teach a lot of people. So since the pandemic hit us all, we have, as you can see on the screen, if I'm sharing rightly, certified more than 77,000 healthcare professional, non-professional, meaning lay people in COVID-19. So way above 85,000 people have experienced a course on COVID-19 adapted to themselves. One of the courses is actually with the American Heart Association. So that's the can be found here on our website. So this is this code. So when COVID-19 hit us, they, together with other organizations, updated the emergency cardiac care guidelines, and were in a situation where a lot of healthcare providers, nurses, doctors, everyone caring for patients need quickly to be updated. So this is a free module there, which takes around 40 minutes in total in average, but it adapts to folks individually. So this is one place where it could be relevant today, is to deliver that content quickly and reliably to as many people as possible.
That's great. And it also makes me think about how, it's a learner engagement strategy. And we know the more learners are engaged, the more likely they are to not only learn, but also apply that learning. So it sounds to me like adaptive learning prevents the relearning. So it mitigates them relearning or going through modules of information that they already know, and really focuses on where their learning gaps are or their application gaps are. Does that sound right?
Yeah. So basically many of us have tried traditional e-learnings where, you start and you click through a lot of content, but you can sometimes lose interest because it's like, I know this already, and you click through, and then in the end there are some questions. To counteract that, then you need an adaptive approach where it's, as you mentioned, adjusting, but also once you are potentially about to forget it, maybe months later, that it actually can ping you, and then you rehearse only the parts that the artificial intelligence helps identify that, in my case, Kurum is likely going to forget. That will motivate you to, when you experience a system like that, then you trust that this actually knows you better than at least the one size fits all kind of e-learning.
Right.
So I think that's one of the responses we get from health providers when they've used an adaptive approach to learning, that it's more sticky because it was not wasting that time. And time is so precious for any adult worker and any kid, and
Right.
that's why it's used also in outside adult learning in higher ed and in K-12.
So awesome.
Yeah.
So can you tell us a little bit about how it can be used to scale up? So how it can be used in terms of retooling or reskilling?
Yeah. So another concrete example during the pandemic was that we may, run out of resources, both in the form of machinery, so ventilators as an example, but also the human resources that are going to take care of the patients, because there was a risk that, that the capacity, the system's capacity to handle all the incoming potential COVID-19 infected patients won't be enough. So to counteract that, we worked with CAE Healthcare, a simulator company, and developed a ventilator reskilling course. Another course that is around the 40 minutes that basically could quickly allow healthcare providers that are not comfortable necessarily having used ventilators recently to quickly get reskilled, at least on the cognitive part, before they were standing in front of the machine.
Right, right.
That also was a free module that was out in April, and is still being available out for health professionals globally.
Yeah, that's great, because in the last many months, as you've mentioned, it's not just nurses that had to, I as a former ER nurse, I know what a ventilator does. I know what tidal volume is and peak, but I've never actually had to change the dials and what to look for on the ventilator itself. And I imagine, many ER nurses who had to upskill to be able to do that, or respiratory therapists who worked on a med-surg floor that then had to help with surge capacity in a critical care environment, or even ER physicians who theoretically understand what needs to change on a ventilator, but maybe not really knowing how to do it. So it's I feel like adaptive learning, again, it removes all of that extra or waste in learning and really focuses on what people need to do to be able to perform.
Yeah. And to your point, logistically, that can also be a challenge. So even if you had, let's say, in a ward, 2 experienced people on ventilators that could actually train 20 others and say, we can do it at 1 p.m. But, on a ward, are you available at 1 p.m., all 20 people, to do the training, especially in these times where you, first of all, may not be able to congregate a lot of people. So having a tool that when you are available, anywhere, anytime kind of, but also self-paced, allow you to play around with the PEEP. What happens if I adjust it? And I'm not a practicing clinician, so when I kind of tested it before it was released, even I, could refresh and say, oh wow, that's what happens with the lungs if you give it this amount, and this is what happens if you pull it the other way. So there are some interactives as well that helps you learn key concepts of physiology in a diseased lung and in a normal lung. So I think that part of that module was especially popular.
Yeah, and it also, to your example about the experienced providers, it's, if they go through this type of learning environment, then those experienced providers can be used as evaluators or validators. They don't actually have to take the time to teach it, but they can do in real time observation and practice evaluation and remediation if needed.
Totally. So that's like the whole development around flipped classroom, right?
Right.
Where the more experienced, either the teacher or more experienced practitioners, can actually look at the data from others that they're allowed to see, of course, if they are, and then say, all right, here it seems like there are some knowledge gaps. Let's then focus on that part that is maybe not necessarily where adaptive learning and on a computer may not be the best means of learning that learning objective. And then you do it with a skill simulation or something else together with a group. Now, of course, the challenge is in a time of COVID, how is the classic instructor-led training, how is that going to be? I mean, I don't have the answer,
Right.
like 100%, but of course, one component is to do as much as anyhow possible virtually. And so we will, I think, see much more of this kind of learning where, you know, informal and formal, where bigger groups are discussing aspects of a certain part of a curriculum or a video. And I think probably also some of the strides that we have seen in virtual training may also be more prominent. I don't know, what do you think in nursing? Is VR and simulations, is that gonna online, is that gonna grow more, or what is your thought?
Yeah, so that's, I'm so glad you put me on the spot because I just
Because I don't
wrote
know.
a couple other little notes down. So I think about how even within the ANCC, we've, you know, flipped the traditional model of professional development that is time-based on its head with our outcomes-based continuing education. And I also couple that with what's occurring in a lot of academic arenas where they're focusing on competency-based education, where grades are not a measure of success or learning. So the credit hour is not weighted in terms of a measurement of learning. And so when you say that, I think about that, because if the model of a teacher standing in front of the classroom is shifting, and it is, and it's shifting rapidly, and we don't know when K through 12 schools will open or colleges and universities, it really brings me to think about how these methodologies, when infused with technology like virtual reality, adaptive learning, are really going to be more mainstream in terms of driving and facilitating the learning. And then you have people like me or you who are then taking that information and working one-on-one or with groups of students to dig deeper and fine-tune skill and application. So I think it's that traditional model of forcing education and forcing learning is going to be more a partnership and a facilitation.
Yeah, definitely.
Yeah, and especially with clinical, we don't know what's going to happen with nursing students in clinical environments. And so are things like virtual reality, where they're, you know, they have the virtual reality goggles on and they're doing things in a virtual way, and then they master that, and then they go to the practice setting. It might change the professional model from what they learn academically and then how they perform in the professional environment.
What, and now I'm asking you, because you know the space better, but what about, so of course VR, that's one of the advanced options and the cost associated with that, but what about the existing skill labs? Would you imagine for those things that you need hands-on skills training, would that be, you know, an instructor or video watching someone doing it, or just in lesser groups to continue doing parts of those trainings in, let's say, in 6 months or 9 months? We can't look maybe that far ahead, but what will be the model of kind of hands-on skills training?
Yeah, I think that's a great question, because it was actually something that our viewers and listeners will hear more about next week, that I spoke to another group earlier today about shifting the live simulation environment into a virtual environment. Whether that be one learner on a simulator, and then virtually other members of the team are doing their pieces. So think about perhaps ACLS, where the learner's in the room actually doing chest compressions.
Yeah.
Then they have to change their role to manage the airway. But the other members of the team are either somewhere else in the facility,
like here,
or they're home, like this, where they're scribing, or they're the ones that are leading the codes through a virtual environment. So I do think that will happen, especially with social distancing and trying to mitigate risk of infection among healthcare providers, and everything that's occurring with, making sure the PPE is in the right place and not being used in a place where it could be considered wasteful. So I think, something like adaptive learning, where they can fine tune the knowledge, fine tune the skill.
Yeah.
Then they spend less time in the live simulated environment than they do today, or they did last week. And I say that as a former ACLS and BLS instructor. I think about, we would have 30 or 40 learners, and we would have 5 simulation stations with 5 or 6 learners in each station. That's probably not going to occur for a while.
For a while, yeah. No, you're totally right. I think video for sure, no matter what, because that's, with the global bandwidth is pretty good. And even in, I would say, countries where you may not have that much equipment, I'm thinking more,
resources
outside the US as well, and even maybe in the US, how will you conduct hands-on training? And I think just us talking here, I could do something hands-on sitting here, if I had, something that to illustrate that, I'm doing the CPR, whether that's a mannequin that can be blown up or something else, or if it's a surgical procedure, I can show it to you and you could tell me. So I think we'll see much more video, is my personal prediction. I think we're getting much more comfortable with video, like us chatting right now without our coffee but water.
Well, I have my coffee.
I think I'm seeing my kids. I mean, my son is 7. They can do these breakout rooms. So I think you will see potentially groups of 30 nurses or 30 medical students, or the groups of health providers online actually learning together. So I think we will see. This is such an unprecedented time where we have so much technology available, so much creativity, and so much, I would say, resilience in the system, that I think it's hard to imagine in 12 months what we would have learned. But I certainly think, like we met last year where I spoke to your conference, right? Think about what we spoke about at that time, where one of the things I said at the conference was also that I believe that nursing will lead the way, not just in adaptive learning, but in the future of learning. You've always been leaders as a group globally. And I think this year, the next 12 months, and when we sit and have a chat in 12 months, it'll be a whole other speed that the whole nursing community will move, I believe. So I mean, I think even in these hard times, I think there is hope to see that there's been so much investment in good training tools. There's so much available that we, via creativity, I think we will be able to continue making sure that people are upskilled, skilled, and safely practicing healthcare. Because that's the goal, right, of all training.
Yeah, I can't agree more. I think that this is, and selfishly being in professional development, I can't believe that how relevant professional development is, and
it's
how
so relevant right now.
Nursing, you said it, I didn't. Nursing is really, they are pioneering in this space in terms of how to take teams, and not just nurses, but physicians and physician assistants, and really looking at how a team can change its dynamic and its skill set, and how care is provided So it's really not only are they pioneering it, but in my humble opinion, they're really fostering interprofessional teamwork as well.
Yeah.
The other thing I was thinking when we were talking about things like ACLS is,
Mm-hmm.
it might be also, with things like adaptive learning, it's might be time to really reevaluate. For example, does a critical care nurse or physician or ER physician or paramedic have
Mm-hmm.
to renew an ACLS
Mm-hmm.
card every 2 years? And, are there opportunities through partnerships and, places like the AHA where they look at a different type of recertification model
Mm-hmm.
where their experience is validated in real time, but they can use things like adaptive learning to do the education and hone in on the areas that need the focus versus taking the whole course over and um,
I th-
those types of things.
Certainly in the both in ACLS and BLS
BLS, mhm.
and other certification areas, I think
Stroke. Mhm.
where I mean the situation that we are in right now will increase innovation for sure.
Right.
So I think that I will be very surprised if we don't see much more innovation because of this. I
Mhm.
think the needle towards more formative assessment method in general has
Mhm.
been moving for a long time, I would say, for the last few years, where doing high stakes summative assessments to get a certificate or pass an exam has been, let's say, up for debate.
Mhm.
But there's, of course, it's a whole system that it takes kind of a lot of energy to move. But I think with the situation now, as you said, I mean, it will have to move in a direction where we still need to make sure that people have the skills, and we know that they've mastered certain things, so we know that safety has been taken care of. But using the technologies that are today available, adaptive learning being one of them, is going to be paramount, I think. And organizations, you will see a lot of organizations moving towards that, the more formative assessment model, where you ongoing show that you have proficiency. And if you have shown that, then you don't need to do a summative kind of exam, but you basically stay certified,
Yeah.
because there's a system that says, oh, Kuram and Jennifer, they know this, or Kuram needs this additional. So a much more, should we call it, individualized certification?
Mhm.
I think it'll take some time, but that's where I think things will head. And obviously more online, because again, the in-person kind of will be challenged for the next 12, maybe more months.
Correct. Yep.
Yeah.
Um, I know we had, this is supposed to be organic, but we did have a
Yeah.
couple questions that we wanted to make sure we hit. And
Yeah.
the last one I had was, why is this important for professional development? But I feel like we just nailed that in the last 5 minutes.
Definitely. And I think
Yeah.
if we think, I mean, we'll hopefully soon come, past this pandemic. But one thing we certainly have learned when it comes to professional development is that a reliable system in place
Hmm.
has to be there, so we don't
Right.
scramble. Hopefully not next time, but if there is such a thing where everyone, the whole world, is forced into lockdown, the health system gets under pressure. So like we have other emergency measures
Hmm.
like PPEs and other scenarios, so that you have things in ready if something happens. I think when it comes to training and professional development, one thing we've learned now is that you need to have a reliable system in place, that if you need to stop classroom teaching, you need to be able to switch quickly and have a system in place that that doesn't break. So I think that's for like the underlying kind of thing around professional development is reliable learning systems
Hmm.
are needed. So I think that's one key takeaway, at least for me, looking at the last 8 weeks that we've been going through.
Yeah, I love that. Reliable learning systems. It also makes me think about how we have to almost commit to not go backwards, right?
That was what I
That
meant. Yeah.
as we gain more normalcy, that we don't revert back, because we've had so much innovation and ingenuity that we keep that momentum going, and that we steamroll through it, and that we recognize the importance, to some of your earlier points, of consistently being proactive in
Yeah.
professional development and learning, and not reactive.
100%. It'll be, I mean, it'll be, I wouldn't say a waste, but it'll be a pity if the efforts that we are all doing right now, if they are not turned into good habits and building more strong learning organizations. So my wife would say that please don't stop baking bread, because I actually learned for the first time to make bread every weekend. So we've all learn to stop and figure out, is this something that we need to do differently, both of obviously in our professional careers, but we've also done changes in our personal lives. So I think getting the best out of whatever we can in this horrible situation, I think that's important on all levels. I think it's a good way to round it up.
Yeah, no, I think it's great. What do they say? It takes 90 days to change a habit. So
yeah, exactly.
if I think we're approaching our 90 days, right?
Definitely. Yeah.
So, well, did you have anything else you wanted to share or add? I know you're very busy.
If I could, and we have been in person, I would have shared some bread with you, some homemade. But maybe, and hopefully next time we will, I'm sure, see each other on Zoom or something like this again. But at some time we can see each other again, and I hope that we can share more things.
Yes, I absolutely do. I'm not going to put you on the spot in a video because that would be unfair, but my mind is already spinning about how we can continue the conversation, and maybe have you back at another live event in 2021. And I almost guarantee that, based on this web chat series today, that our viewers and listeners are going to have questions. So we might be inviting you back, if that's all right.
You're welcome. I would love to.
Well, thank you again.
Thank you.
I really appreciate your time, and we'll see everybody next week.
Thank you. Thank you.
Thank
Jennifer.
you.
Thank you.